Okay, so we're here today with Kevin McGarvey, the CEO and co-founder of Hippo Health. Kevin, thank you so much for joining us today as one of our SMEs and advisors, but also you're going to be one of our judges for this hackathon, which is really awesome.
Yeah, no, really excited, Katie. Thanks for having me.
Yeah, so just to get started and ground everybody a little bit, can you just give us a brief description of what Hippo Health is, what you guys are up to these days?
Sure. So our company was co-founded by three emergency physicians who all work together here in the Front Range in Colorado for about 10 years as a team. And we were in the trenches feeling the pain of everyday healthcare and seeing how patient care was suffering from lack of communication and often lack of human connection. And ironically, we've worked to build technology to try to restore the human connection in healthcare. Where we've found that there's a lot of issues with burnout, with support staff, care team staff, physicians, and patients are equally as frustrated. So we've set out on a journey to try to solve for that problem. And that's what's led us to build Hippo Health.
Yeah, it's awesome that you talk about kind of your experience as being doctors. I feel like we think so much about patients having a hard time or being in pain or being imperiled when they're coming in to get medical attention, but we don't spend a lot of time thinking about doctors, nurses, support staff, and burnout and fatigue like you're talking about too. So it's interesting to think about it as a much broader marketplace that you're trying to serve instead of just patients.
Yeah, ultimately we want patients to feel cared for. And one thing we believe is that we need to fill the cups of the care providers in order that they can give care. So trying to build workflows and technology that enables ultimately patients to feel cared for. So.
Yeah, I mean, it sounds like you were experiencing a lot of that kind of pain yourself and watching it happen around you, and then had friends, coworkers, or co-doctors that were experiencing similar things. But the shift from being a doctor full-time to being a CEO must have been pretty significant. Can you talk a little bit about how you made that transition?
Yeah, I mean, it's a continuous transition, just still learning every day, and very different to do work that was, you could see tangible results from within sometimes minutes or hours or at the end of a shift in the hospital, and feeling gratification from helping people get better in an acute emergency or issue in the hospital. The work with the startup is very different. It's a lot more gray, and that makes it all the more exciting and challenging. But it's more of a time frame of years rather than minutes to hours. So.
Yeah, that's a good transition. How long have you guys been at this? I mean, I saw you guys posted an investor update today, and that's awesome. But tell me a little bit about the kind of arc of beginning to now.
Yeah, so my medical group got acquired by a private equity-backed entity about 2.5 years ago. And I decided to jump off a cliff and go all in on trying to build something different for the industry that I got to work in for quite a few years. So it's been about a 2.5-year journey. A number of successes and failures already along the way, and more ahead without question. But just continuously trying to better ourselves, better the team towards the mission of really improving healthcare for all Americans.
Yeah. I mean, medical and healthcare in the United States, but also globally, just is huge, right? And it just seems like getting started in that space is Herculean. Like it seems like just, maybe Sisyphusian is a better word, like rolling the boulder up the hill and then waiting for it to come back down, right? Like,
this is a good, yeah, right.
Yeah.
No, I think it is intimidating as far as when we started. I think the issue of trying to boil the ocean can easily happen in any industry. But with healthcare and the sales cycles, and just the reimbursement and regulatory structures that are put in place, it does have a number of friction points, like any industry. But I think that by just listening to the market and listening to the people in the trenches doing the work, we've been able to really focus on some unique solutions that seem to be getting some early stage traction. So it's just every day is learning what customers need and what we can be doing better. So.
Yeah, I think one of the things that we talk about a lot as we're kind of doing this hackathon is having the intersection of different types of backgrounds of people, right? So in your case, you had all the medical experience you could ever want and more. And then perhaps, you had to get help on the technical side, or you had to get help on the distribution side, or, whatever. But how, you talked about boiling the ocean. I feel like with medical that the stakeholder map alone is just chaotic, right? So how do you decide what is the right product to build? And how do you even hold yourself accountable for, not pivoting too soon, or pivoting, never pivoting when you need to, right? How do you do that?
Boy, that's a great question. Again, just trying to listen to those that you want to serve the most, as far as the pain they're having with their day-to-day work, the things that they value the most in their work, and then having as fast feedback cycles as possible on the technology development side for delivering products that they as users find useful and they ultimately would use again and again and get benefit from. I think also having a balance between our own internal team's personal, passions and vision, and again, just listening to what people tell us they need, and ultimately that's resulting in I think some unique features that we're building into our technology that are fitting with kind of that Venn diagram of what people need and what our vision is, and just continuing down a path where we have I think 30% of an idea of where the technology goes, and ultimately it'll be, I think, the people using it that dictate how it gets used.
Yeah.
So, developed.
You mentioned that you guys have some traction happening, which is wonderful. Congratulations to hear that. I mean, that's awesome. Tell us a little bit about kind of what traction you were looking for, even in the earliest days of Hippo, and how that's kind of evolved over time.
Yeah, so coming from a physician services background, from providing care, we started there, and kind of working with what we knew and what we could provide, gained some insights into how to best provide care in a virtual environment, using new digital health tools that we felt would improve access to care and improve communication flows relative to some of the traditional access points of going to the emergency department, or ending up at a call center with your insurance plan, that was sometimes a suboptimal experience based on the level of acuity that you might have or the needs you might have. And then just over time, building relationships with technologists who shared similar passions to what we shared, and had aligned interests around going deep on developing technology that would better fit patients' needs at the end of the day. Really, it's really been the technologists that have evolved the product in a way, and the technology in a way that is I think unique and interesting. The docs just kind of came to the table with the pain, and then Jason Sperling and Tom Picos, two of our product leaders, owners, have really built the solution. And just having some processes in place where we can get continuous feedback on a rapid sort of cycle basis as we iterate on features.
Yeah, that makes sense. One of the things that, of course, we think about a lot in blockchain is kind of self-sovereignty, ownership of data, identity, transparency, all those kinds of things. And with healthcare and medical, it's tricky, right? I mean, even getting data across state lines in healthcare is tricky. And yet at the same time, it seems to go places that you don't even know that it's gone in other cases. How do you guys think about that as you're developing a digital healthcare solution? And what advice would you have for people that are starting to hack in the space about dealing with data like that?
Yeah, so personal health information is a really big deal with HIPAA compliance and just with people's value of wanting to have privacy. We do a few things today. We don't currently use blockchain, but we work on HIPAA compliant servers with AWS. Our chief architect has developed 3 HIPAA compliant platforms in the past. We have some privacy policies in place for ensuring that data is fully secure. I think the way that blockchain could impact the healthcare marketplace and information exchange could be dramatic. And I think we're yet to see that come to fruition in any one solution or company. I think the opportunity, not just with security and privacy, but also with exchange of data, with standardization of medical data and information that could be easily transferable between not just points of care and actual like bricks and mortar and health system facilities, but also just allowing patients to own their data a little bit more. And we do have federal policy in place that basically is pushing for that with interoperability and essentially requiring electronic medical records to provide APIs to digital health apps and to patients to allow them to access their data. It's more of, I think, a technology friction point around EMRs being on different versions with different provider groups and who really is paying for an API to get access, as well as how that interface works in a relatively easy manner on your iPhone or Android.
Yeah.
But I think that will come to being over time where we as consumers and patients will start to get more and more access to our own health data. And that, I think, will be a powerful decentralizing sort of phenomenon in the industry.
Yeah, I mean, even the concept of what health data is so different than 10 years ago, right? I mean, 10 years ago would have been tracking BMI and blood pressure and stuff like that over time. And now we're talking about a world where a significant amount of the population of the United States is tracking everything that they're doing all day long with a Fitbit, right? Or an Apple Watch. And all of a sudden you've got 1 billion points of healthcare data that we're not even using in the way that is powerful yet, but could, and also could go one way or the other in terms of positively or negatively used, depending on who owns it, right? So if it's something your employer can get access to then jack up your insurance rates or abuse in a way then that's disconcerting at best, right? But if it's something that over time can get a doctor a better chance at getting the right answer the first time, when someone comes in with a weird abnormal kind of thing going on, it's a much more powerful tool, an insightful tool. So I think some of those things are just really interesting because also, some of those things that have been tracked in the past at doctor's offices, they are under HIPAA, but of course your Fitbit data is not, right? So there's kind of this other piece of like who owns what data and how easy is it to access, particularly as someone coming into the space that's new and might not have had the great level of experience you've had in the medical space and knowing what data is accessible, where the red tape is, how to get those kinds of things. So lots going on that front.
Yeah, very, very complicated sort of dynamic as far as how you procure the information and ultimately how it gets displayed to users, whether that user is a patient or a physician, clinician. There are a number of opportunities as well as ways to make it less than digestible. And so I think there'll clearly be companies that figure out how to do things in a way that will benefit the physicians and their workflows as well as the patient's health and their care experience at the end of the day. And that's the exciting part. So, yeah.
Awesome. Well, that's it for me on the question side. Thank you so much for taking the time to chat with us today. And we're looking forward to having you see all the projects that come out of this thing.
Yeah, it'll be fun. I'm stoked.
Yeah, awesome. Well, have a great 4th of July weekend. We'll talk soon.
See you, Katie.